So you've had your urodynamic test, and that's been really useful. It's told us exactly what's going on. The problem is one of weakness of your sphincter muscle. That's the muscle that should squeeze your pee pipe shut all the time, except when you pass urine. It's too weak, so when you exert yourself, the little bit of pressure in your tummy is actually pushing a bit of fluid past your sphincter muscle. Now that's obviously having great impact on your quality of life. Sadly, we don't have a tablet or anything that would sort it out effectively. It would really have to be an operation. Now, is that something that you would be keen to consider?
Oh yes, I think so. I mean, at the moment, it's just hopeless. I don't know.
Okay,
yeah.
well,
yeah.
Understandable.
Yeah.
It's quite severe.
Yeah.
So, what we have to do is let you know about a couple of operations that exist for this situation. Now, for a very long time, we've had an operation called the artificial sphincter. Well established, it's something like 30 years. And it's proved very effective over the years with a good cure rate and a low side effect rate, but not non-existent. The operation is a fairly big one. It's not as big as the prostate cancer surgery that you've already had, but it's certainly important. And it's really important because we're going to put in a foreign body, something that actually squeezes your pee pipe shut all the time so that you can do your activities. But then when you need to pass urine, feeling your bladder's full, you go to the toilet and you squeeze a little component of the foreign body in your scrotum such that you would then be able to pass urine naturally. Now, as operations go, we understand it very well. It can be effective in many, but there are potential important side effects. And the most important thing being that if it were to get infected, then we would need to intervene and probably actually remove the thing altogether, okay, which is quite a big complication. Now, understanding all that, recently there's been an operation introduced called a sling. And a sling's been used in women for a while, and that's now been extrapolated onto men in the hope that they will get benefit as well. And there's been some early research into this, but it's only been around for a small number of years, so our real understanding of it is very limited. Early signs are promising, but we don't know about long-term effects, absolute complication rates, and situations like that. It's probably a smaller operation. Now, what I can't, hand on heart, tell you is the relative advantages of the two. Is one better than the other? Because we haven't had them around long enough really to say that, and we've never done a proper comparison study. So what I'd like to suggest to you is we're actually doing a study to compare the two approaches. Okay. So that what we're doing is men in a situation like yours, we're putting half through the artificial sphincter operation and half through the sling operation. Now, it's called a randomised trial, and the importance of that is randomisation really means that it is by chance which operation you would get. That's the actual nature of genuine research. It means that people will be very similar getting the two sorts of operation, and therefore we can do a genuine comparison between the two. Now, in terms of research, that's really the ideal. That's how we actually understand which operation is better. Very similar groups get the two different operations and we see the outcomes accordingly. And that's something that I hope you'd be willing to consider.
Okay, now when my cancer surgeon spoke, and because obviously I went back to him and trouble with the leaking urine, he said, oh well, the thing to sort this out is a sling. And I know someone who actually who's had the sling operation, so why can't I just have, could I have that in the NHS?
Well, sadly no, the NHS is not a standard intervention. Standard interventions in the NHS have gone through a body called NICE, National Institute of Health and Clinical Excellence, and they have to weigh up whether there's sufficient evidence to justify a new operation as being safe and effective. And because there isn't this good quality evidence to support the slings, NICE has actually said, no, we cannot offer slings as a routine NHS treatment. Okay.
Okay.
So it's not available routinely on the NHS.
Right. Okay.
But there's another point there, isn't there? The prostate cancer surgeon commenting on the treatment of any complications from their surgery. It's quite an interesting situation, that one, of course. I would emphasise that a prostate cancer surgeon is an absolute expert in the cancer side of things, but they don't spend their working time working with functional urology, incontinence, for example.
Yeah,
so they don't devote the same level of perusal of published evidence on this. They also have a slight sort of nervousness about if there is a complication from their surgery. They want to sort of give the implication that there's a nice small thing that would quickly sort it out. We really need to answer them.
Yeah.
Is there genuinely a nice small thing that could sort it out? We don't know yet.
Yeah.
As to your friend, I'm delighted that he's had a good outcome. And certainly we have good optimism that both sorts of operation will have a good outcome.
Okay.
But we need enough people. Can't rely on one person only. That could give quite a misleading impression potentially.
Yeah.
We need
Okay.
hundreds to really answer that.
Yeah.
So our suggestion is you're in a situation where you certainly would warrant surgery. You're bothered and keen on surgery. We've got two operations that might work, but we can't really honestly tell you which is better. They both seem promising for you. So we would seek to randomise you between these two. Now, the final thing that's missing is you haven't really had detailed information about what the operations involve and what potential side effects could be.
Yeah.
And that's crucial. You need that information. And my suggestion now would be that you head off and see our research nurse, who's a lovely lady called Debbie, and she can go through all that and answer any questions you have in detail, and anything that she can't answer, she can come back to me, and then we can just check that you've got everything that you need to know. Is that okay?
Sounds fine to me.
Great.
Hi Mr Goodman, my name's Debbie Delgado, I'm a research nurse. I understand the consultants asked if you'd be happy to talk about a research study.
Yeah.
So I'll just run through things. You don't have to make any decisions today. I'll give you the information, you can then take it away and have a think, and then we can call each other afterwards. So if I show you the surgical information leaflet, I can go through it with you and then I say you can take it away. So as you may be aware, there's two types of surgery currently available for gentlemen in situations such as yourself, having had a prostatectomy and having trouble with incontinence afterwards. The first type is called the artificial urinary sphincter, or the AUS, and there's a picture here. And essentially how it works is there's an inflatable cuff placed around your water pipe, your urethra, and because it's inflated, it means that it sort of closes off that water pipe. So if you cough or sneeze, and if that's the situation where you usually have a leak or you exert yourself, then you're less likely to have a leak in that situation. The idea is that we cure you, but it's not 100%. So the inflatable cuff, as I say, goes around the water pipe. There's also a balloon which fills the cuff, which sits in your abdomen, and there's a pump in your scrotum which you operate. So when you have the surgery, you'll have an incision between your back passage and your scrotum, and you'll also have an incision in your abdomen to place these three. What happens is initially it won't be activated, so it won't work straight away after your operation, but 3 to 6 weeks later you'll come to outpatients and they'll tell you how it works. Basically the cuff then will be inflated by pressing the pump in your scrotum, and then every time you go to the toilet you'll need to press the pump again to deflate the cuff. You'll pass water and then it will naturally refill a couple of minutes later. Does that make sense to you?
Yeah, that seems to. Yeah.
Do you want to ask anything about that at all at this stage?
No, not at the moment, I don't think, no.
Okay. This type of surgery has been around for about 40 years, so it's currently sort of what we're using at the moment. But as I say, there's also another type of surgery which has come into being now, which we're trying to test against this, which is the point of the study.
Okay.
The second type of surgery is called the male sling, which is in this diagram here. And essentially the idea is that a synthetic mesh is placed underneath the water pipe, and then so you'd have an incision again between your back passage and your perineum, and then the sling is pulled up and tightened to sort of lift and elevate the water pipe so that there's more sort of resistance. So when you have your cough or you sneeze, or there's an instance where you're likely to leak, it's more likely to prevent that. This surgery hasn't been around for quite as long. It's been around for about 4 years. And what we're trying to do within this study is to compare the two to see if they're both the same or whether one's better than the other, and how sort of gentlemen such as yourself feel about them.
Okay.
Okay. So the study itself would follow you for a 2-year period. The main point of the study is to establish which is best of the two surgeries, is that you'd be randomly allocated to one or other by computer.
Okay.
So that means that you wouldn't get to choose which surgery that you had.
Right.
And also we wouldn't tell you prior to having the operation, only when you wake up would you know which operation that you'd had.
Okay. Right.
Okay. What we do is we would collect some information from you beforehand. That would include a bladder diary, so a 3-day diary charting what you drink and what you pass water and if you have a leak. A pad test, which you may have already done, which you collect the pads that you use over a 24-hour period, and then we weigh them to calculate how much urine loss you've had, and some questionnaires. But as I say, this can usually be done when you come for your pre-operative assessment prior to surgery,
Okay.
so it won't involve an additional visit to the hospital at all. When you have your operation, I'll come and see you on the ward, and I'll just collect some information as well from your medical notes. And then following that, you're followed up postally at 6 months, 12 months and 24 months.
Okay.
And at those time points, it's a questionnaire, and we also ask you to redo the bladder diary again to see how you're getting on and to sort of chart how much improvement that you've had.
Okay. Yeah.
So I guess you need to think about how you feel about the two types of surgery. They're both quite different. Obviously, with the artificial urinary sphincter, you'd have something within your scrotum, so that would be quite new to you. You'd have to remember that every time you go to the toilet, you'd need to press the button. And also you'd be waiting a couple of weeks, 3 to 6 weeks afterwards to have it activated. The sling surgery is actually, it would work immediately. It might not work at its best, it might take up to a month to sort of reach its sort of optimum, as it were, but that would be in place already and you wouldn't need to do anything. And the key point within the study is that you don't choose. So ideally you don't have a preference, and therefore the computer decides which one you'd have, and then we can follow you up.
Okay.
All right, how does that sound?
Yeah, okay. I've actually, if you don't mind, I sort of got some questions
Sure.
that I sort of reading around and looking on the computer, on the internet and things.
Okay.
I mean, is one of them better than the other?
Well, we don't know at this stage. That's why we're trying to carry out the study. Ideally, by recruiting about sort of 700 men to the study, at the end of it we'll be able to advise clinicians and patients as well what we found out and whether either or is better.
Okay, so what if it was your dad? What would you do then?
I'd have to tell him exactly as I've just said to you, that we don't know at this stage, and therefore I would advocate going in the study.
Okay. And I mean, it's a bit of kit put in you, so would people know, would they know I've got it there?
Nothing's visible. You wouldn't be able to tell from the outside at all. Nothing could be seen, so it'd be very discreet to you.
Okay.
There is the point that if you were in a public toilet, for example, you would have to access the pump, which is something to consider.
Yeah.
But I know a lot of the gentlemen I've spoken to, because they use pads, use a private cubicle anyway, so I don't know if that's a point to think
And the
about.
bit is sort of right in here where you sort of sit down, so what if I'm riding my bike? I mean, would it press?
There is a possibility that riding a bike that you may have some awareness. What we generally advocate is that people use a gel saddle, so it makes it more
Okay.
cushioned.
Okay. I think I follow how that works, because you've got water going about and a cuff sort of blowing up, but I mean, how can this work?
You're not the first to ask that. It's a little bit difficult to visualise, but the water pipe sort of comes in an S-bend, if you will, and the sling sort of lifts it slightly and also compresses it, and that's more resistance then, so when you cough, sneeze, exert yourself, it's more resistance to prevent a leak then from the sling.
And this has got something I've actually got to go and press, so what happens if I don't know, if I get demented or have a stroke or Parkinson's and my hands won't work?
Sure.
What would happen then?
Well, obviously, if you weren't able to operate it yourself, then we could deactivate it, so we just turn it off essentially, and then you'd be back to leaking as you were before the surgery.
Oh, right, I see. Yeah, okay. So this is a sort of easier operation, and then, I mean, what if I decide not to be in the trial? And could I just go for that?
Because the sling, we don't have as much information, any research carried out or long-term research carried out. The National Institute of Clinical Excellence, NICE, which you may have heard of, the government body, don't advocate that slings are offered routinely on the NHS, aside from within a study such as this.
Yeah. Okay. Okay. Thanks very much.
Okay.